Good morning, everyone, or good afternoon, wherever you are in the world. Welcome to our event on centering cyber biosecurity. My name is Leah Walker. I'm a defense technology research analyst at the Institute for Security and Technology, and I'm thrilled to be presenting you this fantastic panel. A special thank you to all of you who are tuning in with us today live on Zoom and on YouTube. And I encourage you to, as the discussion goes along, please use the Q&A function to submit any questions you may have for the panel. We will try to answer as many of those as possible. And we will also be monitoring socials. If you want to tweet at us or comment, we are thrilled to have any interaction. Now, I would like to turn it over to the moderator for this event, Steve Lewis, who is joining us from his role as the Senior Product Manager for Gene Synthesis and Synthetic Bio at Thermo. Steve, over to you.
Hey everyone, it's great to be here today. Thank you so much for joining in. As Leah mentioned, I am Steve Lewis and I currently work for Thermo Fisher Scientific, running a biomanufacturing portfolio as a product manager over there. We've got a great discussion planned for today and two wonderful experts in the field. Really pioneers, I would say, in the field here joining us today, Eleonore and Nina. So let's go ahead and give them an opportunity to introduce themselves, starting with Eleonore.
Hi, everyone. It's a pleasure to be here. So I'm a senior fellow with the Global Center on Cooperative Security in New York, and I work with the UN, the World Bank, governments, and private sector actors. I lead research projects on the security and governance implications produced by the convergence of AI with other dual-use technologies, so including cybersecurity and genomics.
Great. Nina?
I always feel like it's really hard to do anything after Eleanor. So I am the executive director of the Biohacking Village. I've worked in medical, specifically hospitals, for 16, 17 years, and the connected IoT devices. Currently, I do stuff with the government and particularly focused on cybersecurity in the biological field, which includes the devices, et cetera.
Awesome. So good news to everyone out there. Eleanor, Nina, and myself know each other going back a few years as well. So we should have a pretty fun and breezy discussion today. So really, you know, to start the topic off, we've heard it referred to as cyber biosecurity, biocybersecurity, digital biosecurity, or just simply information security that gets applied to the life sciences and the laboratories. I'd love to start out just by asking, generally, what is your opinion on the different labels that we have for this emerging discipline? And do the labels even matter? Because I know there's some controversy over what to kind of name this intersection point between information security and biology or biotechnology in the life sciences. Why don't we start with Nina?
So when I have this conversation with people, I always bring up that there is a WHO definition for what biosecurity already is, and it's more agriculturally based. So I learned that from you, and it then becomes, are we changing it's a Shakespeare moment, right? A rose by any other name. So are we just doing cybersecurity in healthcare and then we'll just call it biocybersecurity? One of the dilemmas that I personally have constantly with calling it biocybersecurity, whatever, is that most of the devices share code with other IoT devices. So does it necessarily have to be for healthcare or for bio? To an extent, yes, because of the different amounts of data that's collected within and have to be protected. But I'm still internally having that battle of, does the specificity of the name necessarily matter to get the privacy and the security in it maintained?
Absolutely. Your point, I mean, talking about kind of just contracting words and stacking them on top of each other. I mean, biosecurity did that, right? Like security applied to the biological sciences, healthcare security, all of that. So, disciplines start where they start. And I think the most important thing that I take away is that this conversation is happening at all. It doesn't really matter what we define it as. That intersection of information security being applied uniquely to laboratories, hospital systems, broader reporting networks, what have you. All of those topics now are becoming really important in the security field. And yeah, I totally agree with that. What about you, Eleonore?
It's a good question, Steve. I mean, issues of labels and ownership over a new discipline might have more to do with academic power battles and, kind of positioning than really scientific arguments. So what matters here, and one of the most significant legacies, I think, of the global crisis we face will be the way that the pandemic dovetails with another major global disruption, which is the convergence and democratization of both cyber and biosciences. And so since about a decade, we have analyzed, Nina, myself, how this convergence has made biotechnology both more decentralized, but also more powerful. And so today, most of biotechnologies can be outsourced to very talented people across the globe. And at the same time, the increasing reliance of modern biotech on automation, on AI, computing, makes it extremely vulnerable to exploitation by malicious actors, with potential for both personal but also collective harms. And this not only in the West, but I think we tend to forget this, but also in emerging economies. And so alongside, we live in a time of global competition, what we call sometimes gray zone conflicts, which also leads to a proliferation of cybersecurity and biosecurity threats. So we could define, cyber biosecurity as an emerging discipline, addressing the unique vulnerabilities and threats that occur at the confluence of AI, cyber, and biosciences. But I think we cannot understand the concept without mapping what I call the AI, cyber, biostack, or the scope and depth of convergence between AI, cyber, and biological systems. I think that's really where there is something interesting to map and to better understand. I'm sure you're both kind of looking at this new field of functional genomics, right? How we start to unveil and understand functional processes inside our genomes, and that's greatly helped and developed by better computing, better bioinformatics pipelines, and increasingly AI working as an innovation catalyst, right? So that's really what I see as a most important dynamic beyond, what we want to call it to some extent. And I think something Nina was kind of getting to, and I think her work focuses on that too, to some extent. It's to the convergence and the democratization. You also have an interesting element of personalization, right? So increasingly, you have AI technologies that are capturing biometrics under the skin technologies, measuring blood flow, phenotypic or genotypic threats, medical devices, as she was mentioned. So you have all those different type of synergies that are happening, and I think really that's what this new field is about.
Yeah, and I think one of the themes that you just discussed in that convergence and democratization is that really enables even the conversation to happen. And I think that leads to conversations like, how do we define this field? I think Nina said it really eloquently, is that the World Health Organization defines biosecurity around agriculture, but if you talk to somebody at ABSA, right, the American Biological Safety Association, they define it differently. And so that convergence and democratization also leads to this question of where are those lines blurred, and how do we even define them? And I think that's where this field is today. And there's a lot of opportunity for those on the line and people who watch this on YouTube after the fact. There's a lot of opportunity in this area to really get involved. Nina, do you have any thoughts?
I do. I know. Yeah. I love that you saw my face. So just putting all of these things together. When we look at the way that healthcare and the bio community are put together, there's so many different microsectors that are in what we do for healthcare. We can't we can't do the things that we are working on without electricity, water, HVAC, et cetera, et cetera, et cetera. So when we only talk about how cyber biosecurity or biosecurity is, we are defining it as selecting that we are going to protect the biological data, when if we only do those things, that leaves out a whole conglomerate of other stuff that is inherently in the biological system.
That's absolutely, and that's probably absolutely right, and how I see it as well. I think that's probably a good segue for my next question here. So Eleonore, the theme of convergence, right, as a whole, was one of the themes of the cyber biosecurity landscape paper that we wrote in 2019 with Dr. Lauren Richardson and Randy Murch. For those of you on the line or who watch this after the fact, you can find it in Frontiers open access, and so you can read a bit about our thoughts there. But the democratization and decreasing costs really enables more access for a lot of people. But with that, and as with any emerging technology, you have the consideration around how do the regulatory systems keep up, right? At any kind of new precipice of technology, you really have the idea that technology is moving faster than the regulatory agencies. And so dual use consideration, I know that Eleonore is an expert in dual use research. And so I'd love to hear some thoughts specifically about how policymakers are making progress in this space as well.
Mm-hmm. Yeah, thank you, Steve. Well, unfortunately, I would say the short answer to this is not enough has been done on both the technical and the policy challenges. And in truth, the problem is that we're still operating with the cognitive tools and frames of the past century. Like, so for instance, a few very capable US agencies are doing excellent work on some technical aspects of the equation, but limited to their siloed domain of expertise. So NIST, for example, is doing excellent work on standards in cybersecurity, or CISA on cybersecurity and critical infrastructure, but not necessarily overlapping different domains. Then in the US, you always have pioneers in the US, and you have actually a few very interesting groups, such as the NAS and the US Bipartisan Commission on Biodefense, that are starting to map the convergence space between cyber, AI, and biosciences. But we need far more hands-on, and foresight collaborations to map the cyber biosecurity threat landscape, such as what Nina is doing with DEFCON, or the expertise I provide, for instance, to governments across different regions. So a few months ago, I had a foresight exercise with governments and labs in Germany and in North Africa, the equivalent of our CDC, but working in countries in the Sahel and other parts of Africa that are scaling up, biometrics, bioinformatics pipelines, and genomics facilities, but they do not necessarily have the cyber biosecurity expertise that you need to go with it, right? So the whole question is, how do we get into a more adaptive policy making? How do we do this cognitive turn, right? How do we become good at adaptive policy making? And one of the first things is really thinking about security models, standards, and best practices in silos does not make sense anymore. That's really one thing. We need skills and expertise, capacity building, and foresight that can cut across, across tech domains, AI, cyber, biosecurity. And we need also something that's quite important is incentives and economies of scale between the private and the public sectors. So those guys need to learn, how to work together, but for a reason. There are ways to build incentives and economies of scale so that they don't have to start from a clean slate on each end. So it's really a shared responsibility to, think about those threats, but also at the same time preserve the capacity for data sharing and interoperability, because we also need that. We also need that form of data sharing for collective security, right? Think of pandemic disease surveillance systems, all of that. So how do we tackle that tension? I think we need a cognitive turn and certainly breaking the silos.
Yeah, I think that's really all insightful. Now, Nina, I know you also do quite a bit of international work in this space. I'd love to hear your perspective on that question related to international policies, and then I have a follow-up question as well. But Eleanor and Nina, I would say, just for those who don't know, and hopefully you do on the phone, I'm sure you do, they're both policy regulatory experts and have been for many years, specifically in this space. And so, they're the folks to reach out to if you have those kinds of questions. I have experience there, but nowhere near the level of expertise that these two do. So real treat today to hear their direct thoughts on this. So Nina, what about from a international perspective?
So I'm gonna go from the US first. In 2017, there were 629 different policies, regulatory policies, just for hospitals from 4 different regulators in the US. So if we stretch that out, think about how hospitals don't necessarily have the bandwidth or the funding to translate what all of those mean and put them into practice. And when we look at the broader community, one thing when I have conversations with the device makers or pharma device makers, we work, biology and healthcare generically, works in an international forum. It doesn't just go by one nation. So when we are putting things out, we have to take those things into consideration. It's that there's so many different patients that are working, that are getting help, right? Medical assistance from very specific devices, and they have to be cared for in a very specific way so that this data does not go out and this data does not end up hurting a patient. So I have a lot of feelings about this. I've tried to have different organizations from different policymakers, regulators come together so that we could have a normalized conversation of like, let's just have coffee and chat about this. And it feels very difficult because there may also not be people that are forward thinking in some of these agencies who have the broader conversations, because they're currently dealing with the right now. And because of the speed of technology, because of how we have now enabled patients to do better care at home during the pandemic, and how now decentralized care, clinical care, and clinical trials are going to be, that's a massive data that can have current and future state issues for people. So just trying to figure out what policies, what regulations. So it's laws, rules, regulations, standards, audit metrics, and procedures to help those people get to a better place. I left healthcare after 17 years and I went into finance because they had their big overhaul of what just happened. We need to figure out what happened. We need to put better parameters in place so that this doesn't happen again. And they're so highly regulated. And I loved it because there's no question. It is very black and white about you do this, you don't do this, and that's it. That said, finance does have a piece and a part of healthcare, but what kind of examples can we bring in from other organizations, from other industries, so that we as healthcare, clinical cyber people can do more and do better?
Yeah, I think your point about boundaries and not really being there is such a key one when you talk about this. And actually, when you think about it from like even a global perspective with like software systems and so many different things in the information technology space are actually modeled after biology. And so it's really interesting, like, in this time when we're talking about the impact of the pandemic and how it was global, and like, the pandemic, like biology doesn't really care about your opinions or where your borders are. Information is exactly the same thing. And I think that's a point that's really key here. Shifting gears and sticking with Nina for a second, as I mentioned, you are a leading expert in medical devices, in information security, the bioeconomy, and security policy. You mentioned, and for those who haven't been there, we met at the DEF CON Biohacking Village. And Nina was gracious enough to let me host a session there, which was very, very fun and pretty interesting. That's also on YouTube if you want to check it out. I'd love to hear a bit about what you're working on today, maybe where the Biohacking Village is headed, or just where you're headed personally. What are you working on these days?
So many answers to that. So one of the things that you said when you gave your talk initially was full stack biotechnologist. And I have run around the whole world saying this is a thing and we need to be doing it. And I am fully committed to that. So being that so some background, right? So working in the healthcare sector, my most pivotal moments of change, personal change, and professionally and as a human were when I worked in surgical oncology, because it is ridiculously intricate and the clinical informatics behind it and the documentation, et cetera. So every year when we do the Biohacking Village, I try to get a little closer to what an optimal hospital would look like. What would it look like to train people and educate everybody, full stack, right? Full industry. So this past year, we were virtual, which gave us a different kind of opportunity to bring all the things to all of the people. So we now have 5 labs. I think when you were there, we had 2. So we have 5 labs now. So one is for speakers, and they come in and they talk about the cool new things that they've worked on. So the emerging technologies, anything that had happened that they want to follow up on. We also have a catalyst lab, because understanding that people work differently. So this one is it's a hands-on workshop. The other one is a device lab where manufacturers come in and they say, break my stuff, take my things, break my stuff, tell me what happened. And we do vulnerability disclosures in real time. We also have a capture the flag. So starting from absolute novice into, we created our own site for the dark web, so people can go in there and feel what it feels like and try out the activities. And we also do a tabletop exercise that's very Machiavellian in manner, and we go to failure because there's too many times where people are like, oh, this is too much, I do not want. We go all the way through it, and then we do the burn down to talk about what happened, what should have happened, what follow-ups do they need, what information would help. So what I'm doing in about a week, I'm going to be doing this more on a full-time basis of getting the Biohacking Village to go to other conferences, do more things, engage more people. There's a lot of folks that initially were like, I do not understand why we care about bio in security in bio. And the answer is usually no one wants to hurt a patient. Understandable. But the thing is, when we're in the back end, we don't necessarily look at anything as, oh, that's a medical device. We have to leave that alone because it might be connected to a human. It depends on where you're going, right? On what you're doing. So it's trying to engage people in doing the things, as well as engaging the manufacturers in understanding that while they call a lot of the security researchers bad actors, and hacker has such a negative connotation, but changing it over into, we need them. The government needs to engage with them. The industry needs to engage with them, because otherwise we are going to be in a fail state.
And one thing that, for those on the phone who are not aware of the Biohacking Village, it's actually amazing from just so many different angles. As Nina mentioned earlier, she's the executive director for it. If you can believe it, there's a lot of large organizations that actually attend. A lot of the big biotechs attend, and that is due to Nina including them and inviting them. So it's actually a really great space, not just for, those traditional biohackers, which we can go on probably like 100 hours talking about that definition and all the different ins and outs of that world. But that's a community and DIY bio talk for another day. But what's really interesting about it is there's also policymakers there too. So there's representatives from FDA, really popular companies. And so for those of you on the phone who might be thinking I'm so old. No, for those of you who might be thinking like Biohacking Village, ooh, that sounds scary. That's where all the hackers go. That's true. But it's also true that a lot of really interesting large groups go there, and it really is where all of these organizations and people and individuals are meeting and kind of pushing that boundary. So switching over to Eleonore here, a similar question. Tell us a bit about what you're working on today, and if you have any follow-on thoughts from what Nina just said, please feel free to share as well.
Yeah, thank you so much. I mean, we are kind of complementary in what we do, but I've been practicing foresight, as I mentioned before, but more with international groups, so the UN, the World Bank, think tanks in the counterterrorism space, governments, and to some extent also labs and private sector actors, increasingly not just in the West, but also in other regions. And so, as I was saying, what I'm trying to do is often breaking silos and bridging technical and security divides, creating awareness and more capacity building, especially on the unknown or undiscovered convergences, right, between dual-use technologies. And so, for example, one research project I'm working on right now is about emerging cybersecurity threats through functional genomics. So the integration of AI within biosciences leads to game-changing opportunities, but also a unique security concerns that are completely outside of our legacy governance policies. So in the near future, a type of threat that I think we could be facing and that I'm actively working on is this notion of AI-enabled cyber threats that could be designed to manipulate and corrupt the integrity of data sets and algorithmic models that are crucial to the global knowledge production cycle in biomedicine, biotechnology, and biosecurity. So I give you a few examples of those threats. First type of threats could be manipulating data integrity in bioinformatics pipelines or microbial NGS. So research in AI security has shown that certain types of AI-based malware can be trained to undermine the predictive ability of a wide set of medical analysis systems that are based on deep learning. That's one thing, but the attack surface could actually extend beyond medical diagnosis and clinical trials with malware that could target the integrity of genomics and other omics data sets related to humans and pathogens. And so other experts have shown, I think they actually did it at Biohacking a few years ago, how malware could be used to target the functioning of a genetic analysis software to alter actual fragments of DNA sequences within individuals' genomes. And so such malicious alteration could result in misdiagnosis with impact on clinical decision. But you could also see those kind of injection attack, right, happen on microbial NGS, which could lead to not only problem of availability and operational failure, but to a loss of data integrity and therefore misdetection of pathogens. And of course, when you talk about this with groups in the Sahel, in other countries that are really relying on NGS, but also increasingly mobile DNA sequencers, all kind of connected devices for this, maintaining the integrity of those devices and their data sets and the data flow is really crucial. In a biosurveillance scenario, that's where you don't want to have either a false alarm or a false negative result, right? But I think it's, the scope is so interesting and so deep because in the field of biosecurity, you also see increasingly the importance of computational threat models. So AI being used to help understand what specific functions in genomics should be seen as, a potential concern, right? So actors like Battelle or other governments-led initiatives are actually building algorithmic systems to be able to prevent illicit gene synthesis, to be able to better do different forms of biosecurity screening. And so in that space also, if we are facing increasingly attacks that are undermining the capacity of those algorithmic systems, to figure out what's a concern and what's not a concern, I mean, this is really becoming a very interesting problem and a potential source of failure for different things we're trying to do. So that's kind of the next intellectual problems I'm looking at. And I think, this notion of data tampering, it's really interesting because it also relies, or it also relates to trust, right? And it's not only public trust, it's scientific trust. So there is I think we are at the verge of seeing a shift from systems, cyber-physical systems as a target, to data and knowledge as a target. so almost coming to this point where, we are kind of starting to feel, can we still trust our data sets and our knowledge systems? And to what extent do we trust it? And I think this notion of, how much scientific and public trust can be shattered in our knowledge economy, right? In our bio or in the knowledge systems of the bioeconomy, I think that's really, really important. We saw it with the pandemic. I mean, kind of almost as a real-time, exercise.
Nina, you look like you were going to add something.
So everything, I was taking notes on things I wanted to say, and then Eleonore, you just started answering everything, which I love. And actually, there's a question that what are the roadblocks practitioners face when working to protect the sector on the daily basis? Conversely, what are the tools, policy, and operational measures that have allowed us to meaningfully raise the resilience of the sector? This was what I was going to kind of bring up. We trust the data so much that when a human says that is not correct, we don't believe the human. So, right, I was in the military. I have dog tags that have my blood type on there. If I didn't know my blood type and the person said that my blood type was this, and they give me that first vat of not my blood, they've got that one opportunity to, my body can take that first vat of blood and be somewhat okay. The second time they do it, I'm dead. So how are we going to, so going back to the question, right? There's the practitioners do that vow, the Hippocratic oath of, I'm not going to do no harm. I will do no harm, double negative. That also means that we as security practitioners also need to engage them more in the conversations so that they can have better conversations with the patients. Talking about implantable devices, if you need to go in for a pacemaker, the doctor doesn't have a very long conversation with, these are the devices, these are their security parameters, ask questions, here you go. You've got about 2 hours to go to the lab, get cleared for surgery, and go into surgery because this is life-saving. So when we have conversations with hospitals, they talk about risk, but risk in terms of fiduciary issues, not necessarily anything else. So going in as security folks, we have to also talk about risk in the various different capacities of security with the data, security with hurting a patient. These are all the different risks that they start doing. The tools and policies, operational measures. There are tools.
Yeah.
Uh-huh.
Oh, go ahead.
Go for it. Get in there.
No, I was going to add from the operational level, like one of the things I love about this conversation here is there's so many layers to it. And, kind of cybersecurity 101, you have the CIA, the triad, confidentiality, availability, and integrity, right? And so especially in the life sciences, you have the integrity of data that is really something that you have to trust, and it can have implications in health settings. It can also have implications in laboratory settings too, if you're working with different sequences or organisms. So for those who end up watching this, there's so many different ways that you can get involved. I would say, everything from the genetic security perspective. One of the attendees earlier was a part of a company that's working on genome security. There's another angle that you can take entirely, and it actually overlaps pretty standard information security, but applied to laboratories and kind of everything in between. So Nina mentioned earlier the idea that security in a lab oftentimes means integrity of data. It can also mean a lot of overlapping aspects of biosafety. So things like HEPA filtration systems, making sure nobody kind of taps into different equipment. So like endpoint security for laboratory devices is an area. It's really, there's so many angles you can take. And I think it kind of, one of the controversial questions that I've heard, and I'd love to hear everybody's take on it, because I'm sure you both heard it, is what is different about this from cybersecurity? what is different about just applying cybersecurity protocols to these different environments? And is there anything unique about it? I'll take an answer, or I'll take an opportunity just to answer from my perspective, because I don't want to only put you two on the spot. My thought on it is there are some applications that are unique. I used to do a lot of work with the federal government, specifically on biosafety level 3 and biosafety level 4 facilities. And those have very unique aspects to them that you wouldn't think of, like in, let's say, an office building or in even a university laboratory. There's very unique protocols that need to be taken, both from, everything from an information security perspective, but actually to the security of not just the organisms, but also the people in those environments. And so that's kind of my high level take, because I did a lot of operational planning and still do a lot of work there today in my current role. But I'd love to hear, especially because Nina, you have so much experience in healthcare, and Eleonore, you just have such a breadth of experience that I'd love to hear what are your answers to that question? How is this different than just applying cybersecurity? Whoever wants to go first.
I can go if you want. I think it's really, what we kind of, the three of us came together talking about is this. To me, it's really this notion of data integrity. Of course, data integrity matters in different contexts too, right? So for example, I've been talking with the UN Department for Peacekeeping, right? Because they collect a lot of very sensitive information about conflicts, about commerce, about a very complex ecosystem. And they have to use predictive models increasingly to understand where conflicts could start and how to deal with. And I was kind of telling them, maybe you should look at what experts are doing in genomic security, because it's another domain, but to some extent, you similar challenges of being able to trust extremely sensitive data sets that are in constant evolution to some extent, that have to be at the same time, the object of sharing and interoperability, but also for which the integrity has to be preserved in a very specific way. So that's, where there are actually similarities with other domains. But then the uniqueness here is that, the type of data we're talking about being, genomics data sets for humans or pathogens. For example, imagine, genomics data sets in precision medicine, right? You have in silico models for understanding better and better how different types of cancers are related to genotype and a phenotype. That's a huge amount of knowledge that if we had to rebuild it because it gets manipulated, corrupted, or destroyed, we're losing probably decades of research. So there is this notion that destroying trust into that knowledge that we have built. I think that's to some extent more of a problem than in other domains. Then we saw also during the pandemic the power of disinformation related to anything that's linked to biology, biotechnology, genomics, and I think there is a specific, the level of education you need. I would say the level of understanding you need to be able to trust those systems, and it's the same in medicine, means that this information is even easier in that space than maybe in any other space, and it has life and death consequences, right? So that's another reason why keeping the integrity of that type of knowledge, preventing it from being manipulated, and disinformation is one thing, but imagine that suddenly scientists are not able to trust their own knowledge systems because they know there has been an attack, or and then your own organizational trust is shattered, and so you don't know if you can still say this is safe. We've worked on it for years. We know it's good. Trust us. We can use it for a vaccination plan, so that's really where I think it's almost like the basis of our social contract. It's trust, in our biology and how we understand it, and what kind of decision we take based on it. Even beyond personal privacy, it's that collective dimension that's really, interesting.
Nina, what about you?
So just a little bit on the question, what tools and policies and operational measures? I find that a lot of people have this idea that FDA is the ruling governing body over all of the healthcare everything in the US, and that is not true. They run medical devices. HHS runs the whole of healthcare in this country, and then there's other places underneath that. So just wanted to put that out there. So this part of the question goes into international affairs and human rights, especially for data, because the data is not static. It doesn't just sit in a data warehouse just for this one place. It goes everywhere, and a lot of other people are going to use it for their studies. So how do we engage in the current trust situation that we have in this country and all over the world? How it's sort of been that moment of, do we trust the vaccine? Do we not? We don't know what's going on. And then there are cybersecurity issues in hospitals and other parts of the industry, because there are different devices that need to be secured very separately and distinctly and then put together as a whole. So while bio is very distinctive in that way, where because it's like a body, right? My arm muscles are very different from my gut muscles. They do very distinct, very different things, but they work as a whole. And if one isn't working, it could affect the other. It may not. We have to progress and see. It's almost the same when we look at any biological entity, whether that be the hospital, the medical device, et cetera.
Absolutely. And just to be sensitive to time, to kind of wrap up that question, I have one more question for each of you, and then we can open it up to questions for the group. But yeah, to kind of wrap that up, just as you both were speaking, I was thinking, in security in general, you are talking about risks, threats, and vulnerabilities. And I think in this realm of biosecurity and its intersection with information security, it's really those downstream impacts that you can have. A lot of what I do in my current role is we make synthetic DNA. There's not a lot of companies that do that, but that's one of the things that you really have to think about is, okay, what are the intersections with that information? Well, the actual sequence of the DNA, that can have downstream risks, whether that's you are a bad actor and you're trying to make a pathogen, or if you are a healthcare company or a biopharma company and you're trying to make a biologic and you actually end up putting something in a therapeutic that you shouldn't be putting in there. That all starts with the data. And I would say, to me, that is one aspect of how this realm is different, right? You have to be, and it's always team-based, right? Security tends to be team-based, and you get people's buy-in, and really you build those layers of security together. And one thing I think that's really interesting and perhaps unique about this space is the idea that it's not just life science experts. It's not just information security experts. In my example with sequence security, you have to know, one, how to secure the data, whether it's from an intellectual property perspective, or just in general from a, making sure the information doesn't get where it shouldn't go, right? That's one, that's the information security side of it. But also having those conversations with the life scientist to know, wait a second, if this sequence gets out, here is what impact it will have. To me, that's the unique aspect of this field is you have to have those conversations, because you can't be a life sciences expert necessarily and know everything about information security and vice versa. And that's where Nina mentioned it earlier, that idea of the full stack biotechnologist, I think is a thing coming in the future, is like, how do we identify those individuals who can almost in a way speak both languages and kind of bridge that gap to lead to better security implications. Anyway, or security practices and policies and things like that. All right, so to kind of wrap it up, because I know we're running on a bit low on time here. We'll start with Eleonore, and then we'll go to Nina. If you had one topic that you want our policy leaders to take away and kind of chew on in this area for, let's say, the near term, the next 3 to 6 months? What would it be?
Yeah, the time frame is a tough one, but I would pick, I mean, at least that's what I'm very interested in working on, but I think it should be interesting for policymakers too, but this emerging and unique threat of adversarial data manipulation. So this shift from, a physical threat model to an in silico threat model. In other words, what happens when we do not trust our own data sets and knowledge systems? And so that goes back to two things I've said before, really this shift of biosciences from analog to digital converging increasingly with AI as an innovation catalyst. And so that means that increasingly, it's you're relying on automated protocols in cloud labs. Your labs are not the labs of the past century, right? They are really evolving in a way that the type of knowledge that's being encapsulated in automated protocols, in predictive systems, what kind of data sets they are working with, all of that is an information infrastructure that becomes critical, right? So we tend to talk about critical services, critical infrastructure. This is really kind of redefining the bioeconomy as a critical information infrastructure. So looking at those, that shift from cyber physical system as a target to data as a target, and the issue of trust that's related to it. Especially, again, this is something that relates to so many different pieces, right? You really well articulated the biosecurity angle of that. I mean, preventing illicit gene synthesis, using functional genomics to better understand what kind of unknown threats could be produced. That's where AI and biosciences are going to really be extremely useful, but where you need to be sure there are no data or algorithmic manipulation, data poisoning there. Same thing for precision medicine. I mean, if we do new oncological treatment that are based increasingly on personal analysis of genomics, of your genotype and everything, and increasingly, if you do in silico clinical trials, I mean, how can you be sure you can still trust, the type of data sets you're working with? So for me, I mean, but I think, I don't know if it's only near future, it's kind of a long-term challenge. And also the key tension here is that you also need, Nina said that before too, you also need to be able to share data. There are data flows needed from food security to disease surveillance, to precision medicine, to biosecurity. I mean, even for that, really kind of secret and complex world, you still need to be able to share and talk about, what you are looking at, right? So this is not that's not a project for just for 3 or 6 months, but that's something I would be very interested to help with, and keep working on.
Nina, 3 to 6 months. What are your thoughts? What should people take away? Not just people, policymakers.
A lot of people. So I love the idea of the data manipulation. I am also very much on board with letting the hacker community, the cybersecurity researchers, into the industry, being more open to having them in there. When the pandemic started, there was a lot of momentum. They were the community opened up and said, we want to help. How do we do the things so that we can stop the hacking from happening? So little known fact, I interned for Eleonore, and the class, the master's that I was working on was for translational medicine, and it was technology and bio. And other small fact is that university, when I talked about security and how are we working on security in the technology, they kind of brought up the whole, like, that's not a big deal, don't even worry about it. And I was like, wrong answer. And I had the long conversation with them about, no, here are actually all of the policies, and here's all the things you need to know, and how are you going to address this? And it was just a long litany of conversations and feelings about those things. And now they kind of better understand the security parameters that have to go around things. So they're open to conversations. But one of the things I've asked some of the manufacturers to do, and it's a conversation, is bringing in the hacker community, the researchers, and helping them get cross-trained. Because if they don't understand how the bio side works, it's going to have a harder transition to do the cyber around what are they actually protecting. And also bringing in clinical folks, getting them cross-trained on security so that they can understand things better. So if something is beeping or ringing, that it's not necessarily that, oh, it's just buzzing, it's not a big deal. There may be something bigger going on, that if that one device gets known almost immediately, can help the whole hospital, can help the whole medical system, can help the whole industry bypass a ransomware attack or some other attack, something from happening and getting out into the broader community.
Yeah, very, very insightful for both of you. I think the common theme there is obviously continuing the discussion, but really moving, I think, into that operational space and really making sure, okay, we're talking about it, that's great, but how do we actually apply some of the things that we're talking about uniquely in this space and educate more folks on that? I don't know, is it certificates, right? Like the IT community has a lot of certificates that are taken legitimately. The life sciences doesn't. That could be one angle. I don't know. I think that there's a lot of unique applications here. As I mentioned, most of my involvement in this space has been at the operational level, securing laboratories and information in them. And I really think that, while we were securing laboratories in the best way that we could, I do know that there's not a lot of policies out there that kind of talk about those unique environments. And so I think that might be a good spot to open it up to questions to the audience in, hey, we're here, we're talking about it. How does it get put into action? And I think that that's one thing that there are folks doing it. I think the folks on this call are those people. And I think that there are others, of course, out there as well, but it's a growing thing. And I'm really excited to see where it's coming for the foreseeable future. So I don't know if our IST friends are still there. I do see one question in the Q&A, but it looks like we may have answered it. Are there any others?
Guys, sorry, just jumping in from the IST thing. I'm Andrew Fassini, the Director of Communications, just saying hi. Sorry about that before. My internet cut out, and so if I missed any questions, you can resubmit them to me, or if you want to talk about them later, we can always connect you guys all on social media, continue the conversation well past this event. So appreciate all of the interest that we've got and what will be in the future. So
love it. Well, with 4 minutes left, if there's no other questions, Nina, Eleanor, anything we missed? Anything you really were just like, oh, I wish I said that? Anything?
I have one thing. So the bioeconomy, the biomanufacturing side is not necessarily connected to the healthcare side, and it's not necessarily considered a critical infrastructure. So one of the things post all the things that I work on is we are also introducing a bio-Isac so that we can help the biomanufacturers, synthetic, bio, all of those things, to do better security, to ensure data, to minimize risk, all of the things that we talked about today.
And for those on the line, what is an Isac? Again, why am I saying on the line like a radio host?
Well, you can watch the DVD of this later. So, or maybe just get a VHS just for fun. Yep. Information Security and Analysis Center.
Love it. And I think that, securing the bioeconomy, especially when you're talking from a biomanufacturing perspective, as somebody who runs or I do not run, a lot of people run it, but I have responsibilities around a biomanufacturing facility. that is a conversation that we have actively and needs to be had, I think, in a more unified, holistic way, organized in a way like the Bio-Isac. So I think that that's wonderful and something that I'll be interested to see how it grows over the next year. So, Eleonore, anything with the last couple of minutes?
Yeah, I mean, I would say maybe it answers a little bit the question we had got, to be sure we got that cost. But I mean, something that could be interesting is, you know, when you compare the two fields, right, of information technology and biotech and biotechnology, they were both kind of built with that open source, open data sharing kind of mindset. But one, in a way, is kind of running or has been running into troubles with a little bit of advanced, so digital tech and cybersecurity, right? So if we could look at that field and see what have been, you know, the most interesting or powerful methods that have been used for being able to at least start securing a little bit more the space, but also where there are failures, right? Failures of practices, failures of cognitive framing, lack of cross-pollination of expertise between different groups. If we could learn from that, when we then, you know, try to do almost a better version of it for applying it to the biosciences, I think that could be very interesting. And then, you know, keep thinking about the fact that it's such a multifaceted ecosystem. I mean, what you just described, Steve, about, you know, kind of your experience being in a lab like that, or an automated cloud lab, or, you know, being, I don't know, a very smaller a gene synthesizing company, for example, right? You have some that are very high level, that are well known, that have a lot of know-how and capacity building, but then you have other levels in the whole private sector of biotech, right? So how do we reach out to that different level of capacity? I'm thinking also about, you know, the other regions. I think that there is really something to do with some of the countries that are now more and more getting access to bioinformatics and building those capacities, sometimes in a rush, and not necessarily maybe with the, you know, not just the expertise, but kind of the know-how and the tech there to build security into it, right? So how do we learn from the past failures and inject some of the good ideas and the methods that work in a cross-boundary, interdisciplinary way, right?
Perfect kind of summary, I think, to wrap it up. I saw this. This is loosely inspired from a TV show, but I want to do it to kind of wrap it up. One sentence to kind of summarize what people should take away here for each of you, and I'll go as well. One sentence only.
That's a high pressure question. Be brave. Be brave about doing all this. I love a failure report. I am so tired of people having conversations. That's not one sentence, but it's one like paragraph. I'm so tired of people having their conversations about all the wonderful things that they've done. And I'm like, cool, where's the stuff that got you here?
Be brave. I love it. Eleonore, do you have one?
I don't have a perfect sentence for this, but really, you know, what I've been thinking about since this pandemic is how do we protect or build that trust, right? That social contract, that trust that's at the basis of everything that make medicine and biotechnology a successful enterprise for the public, for all of us, right? A public good, right? How do we preserve that public good? And for that, we need to preserve the trust that has to be part of it.
Love it. My one sentence, and we'll end it, is it doesn't matter what you call it. These conversations need to happen. Thank you all. It's been wonderful. I think all three of us are pretty accessible in general. You can find us on social media, LinkedIn, whatever it is. Yeah, I would be happy. I won't speak for, of course, Eleonore and Nina, but feel free to reach out to me if there are any questions or follow-ons or anything like that. Thank you to our hosts, ISP, for having us. And yeah, thank you to Nina and Eleonore for just a really awesome discussion.
And thank you all three, for participating, for joining, for just having this conversation. It's very important. And here at IST, we're just really proud to have put this together. If you, dear listeners, are excited about these and similar subjects, you may want to check out the IST website for future events, including next week, October 20th, as part of Cyber Week. We are going to have another conversation on hospital biosecurity in a broader sense. So I hope you all can keep in touch, not just with us, but with all three of our extremely great participants here. And if you have any other questions, you can always reach out to any of us anytime. Thank you.